234,000 infants in 2015 died from the measles because they weren't vaccinated. That's 15 deaths an hour. Today, I want to introduce the idea that children should have to be vaccinated if attending a private or public school. By the time I'm done presenting, I hope that you agree children should be vaccinated regardless of their religious or philosophical beliefs. This is important in keeping our children safe and healthy from unwanted diseases that have been eradicated for years and years. When doing this speech, I talked to many medical professionals. I also did a lot of research online, and also when I was pregnant with my first child, vaccinating was something I was very concerned about, doing it or not doing it. So I also talked to many doctors then and did a whole bunch of research then also. According to the Childhood Immunization Schedule and Safety Report, vaccines keep everyone in the United States safe from unwanted disease. However, not everyone receives the recommended vaccines, and this is because of exemptions. There are two different kinds of exemptions. There is a medical exemption, which is an exemption due to either an allergy or if you are immune compromised, and then there's a religious or philosophical exemption, which is due to religious or philosophical belief. According to the American Association of Pediatrics, vaccines are 90 to 99% effective and keep approximately 2.5 children from unwanted diseases a year. Exemptions due to personal beliefs are on the rise. This in turn is increasing the incidences of preventable diseases such as measles, pertussis, and chickenpox. Measles was declared eradicated in 2000, but has recently come back with 667 cases in 2014 and 189 cases in 2015. Pertussis had dropped to fewer than 2,000 cases in the 70s and 80s, but as of 2012 there were 48,000 cases. This all comes from the Journal of the American Medical Association. The Journal of American Medical Association looked at 1,416 outbreaks of measles from early 2000 until November of 2015. 970 of those had vaccination data. 574 of those 970 patients were not vaccinated even though they were vaccination eligible, and 405 of the 970 had non-medical exemptions for religious or philosophical reasons. There was actually an outbreak of measles in 2016 in California at an elementary school due to a child being unvaccinated, leaving the country, contracting the disease, coming back to America, and then going to school. The school decided to not let unvaccinated children come back in case they had been exposed, and it was about 21 days because it was about 15 days because that's the time that measles can lie dormant in the body. There was also an outbreak at Disneyland that sickened 147 people because an unvaccinated child went to Disneyland with the measles. In 2016, in Denver, Colorado, there was a chickenpox outbreak that stemmed from an unvaccinated child attending school. This unvaccinated child got two other children sick. The Denver Health Department also got involved, and they decided to not let unvaccinated children come back to school for 21 days because this is the time that the chickenpox disease can lie dormant in your body. And everybody else was allowed to come back to school. Chickenpox is very contagious, and not being vaccinated not only puts the individual at risk, but everybody around them. And as I already stated, pertussis has made a huge comeback. And this huge comeback has affected not only the population around us, but the pregnancy population also. Cheryl Civils, nurse practitioner, says this rise in pertussis is due to having unvaccinated children. The reintroduction has made it necessary to vaccinate mothers in their 28th week of pregnancy so that the child that is going to be born is protected for 2 to 3 months until they can have their DTaP vaccine when they're born. So what is the solution to preventing the spread of preventable diseases? We as a country are in need of a law a zero-tolerance law that requires all children attending public and private school to be vaccinated. The law would be easy, safe, and cost-effective in helping us rid the U.S. from preventable diseases. If this law were put into place, these outbreak cases could have been avoided. The chickenpox vaccine is 98% effective at preventing chickenpox, and the measles vaccine, or MMR vaccine, is 97% effective at preventing measles. And the pertussis vaccine, or DTaP vaccine, is also 97% effective at preventing pertussis. If all kids were, and this is all according to the CDC, if all kids were vaccinated, no kid would be at risk. Making this law would be an act of Congress, but it is achievable. California passed Bill 277 in 2015, which requires all children attending public and private school to be vaccinated, regardless of religious or philosophical reasons. However, parents are finding loopholes. They are going to the medical community and trying to get medical waivers, and some medical professionals are providing these waivers. So we really have to try to put our trust in the medical community to educate these parents and to not provide bogus waivers. I would like you to picture a world where we don't have to worry about measles, mumps, pertussis, or the chickenpox, and many more preventable diseases. A mandatory law could potentially save thousands of children's lives. Vaccines protect not only the individual, but the surrounding population. Vaccines are also the most cost-effective way to prevent infectious diseases. It costs significantly less to prevent a disease than it does to treat an infected person. In conclusion, the need for a zero-tolerance law is here, and we need to act before these preventable diseases make a comeback. Implementing this law would make our schools and our surrounding communities safer. Please consider vaccinating your children. We already have so many things to worry about, and our little ones shouldn't have to worry about getting a preventable disease. Getting your children vaccinated is safe, and even if you don't have medical insurance, the local health department will provide the vaccinations for free. Please do your research using credible sources and see that vaccines are not dangerous but beneficial to you, your children, and the surrounding community. Thank you.